Okay. Good afternoon, everybody. Thank you so much for joining this webinar. I'm Carlos Nalti, Chairman of Education Panel at Society of Occupational Medicine, and I've been having the pleasure of working with the team on the series of basics in occupational health. Today, the topic is about occupational physiotherapy. I've had the pleasure of working with physiotherapists during my career for several years, and I've been really enjoying working with them, both when they're dealing with musculoskeletal problems and also, more importantly, their biopsychosocial approach in the workplace. I should say that what I've noticed, physiotherapists, they all have likability in the workplace and especially by our patients. Thank you so much to our colleague, Rebecca Mead, for kindly speaking for us today about occupational physiotherapy. Rebecca is a very experienced physiotherapist, qualified over 20 years ago with 10 years experience in the world of occupational physio. Thank you so much, Rebecca. Back to you.
Thank you. Hi, everyone. Thanks for, excuse me. You'll have to excuse me. I have had this dreaded virus, so I keep clearing my throat, but it's a pleasure to join you. Thanks for asking me to speak today. Um, it's quite a broad remit of occupational health physiotherapy. So I've kind of chosen a slightly narrower a topic to look at, which is something that we're definitely seeing more of in our particular practice at Bespoke Wellbeing when we're going out to work with employees and employers, which is just looking at the aging workforce and occupational health physiotherapy and how we can assist employers, assist employees, and hopefully provide a really useful service into those various industries, really. I'm just going to share my screen so that people can hopefully see everything.
Yeah, that's good.
Is that okay?
Yeah.
Yeah. Well, so um thank you for the introduction. I have worked in occupational health for some time. I've been qualified for a physio for a long time, 23 years, I think. Um, but at Bespoke Wellbeing, we offer a wide range of various different occupational health interventions. So hopefully this will be something interesting and we can all have a nice discussion at the end and welcome any questions, hopefully at the end of the presentation. I think it's always really useful to share ideas and people's experiences working in different sectors. So first and foremost, really, I think whenever we're looking at things to do with occupational health, it's just really important that we're looking at what we're actually trying to achieve, what occupational health is. And I thought this was a really nice kind of definition of what occupational health is defined as by the World Health Organization, as an area of work in public health to promote and maintain the highest degree of mental, physical, and social well-being of workers in all occupations. With these three main objectives here. And certainly physiotherapy, I feel, covers those first two objectives really well, particularly the health promotion of workers, trying to help them reach their potential at work, and also assisting employers in terms of working conditions, environments, ways in which people work in order to promote health and well-being. When we're looking at the aging workforce, it's really quite interesting to look at the trends that are happening. When we look at this 2021 census here from the Office of National Statistics, you can see that between that 1981 and 2021, there was a 52% increase in the population of over 65s. And that's projected to increase again by another third over the next 20 years. Now, inevitably, when we've got the population are living longer, people have to sustain themselves financially for longer as well. And that inevitably means that we're seeing a greater rise in older people working for longer too. The state pension age is rising, so people really need to be able to maintain their job roles for much longer than they ever have done in the past. And I think that's really where occupational health of people at work is going to be really key. There's going to be new trends that we need to look at and ways in which we need to assist both employees and employers in helping people stay and work longer, and being able to support themselves. If we look at particularly employment rates in the UK, in 2023, the employment rate of people between 50 and 64 was 71% of that population. Excuse me. It had been steadily rising, particularly since the 90s, when interestingly it was significantly lower, down at only 57%, which I found really quite surprising. I think inevitably with the pandemic, there's been some interruption in that progress happening. People chose to take retirement. It seemed obviously like a natural pause for some people. Perhaps some people found it difficult to return to work after that enforced break. And I think the projection really is that is going to continue to rise further. When we're looking at maybe why people aren't in work, this statistic here is really interesting, that the biggest reason for people aged 50 to 64 to not be working is ill health. Which just shows what potential impact occupational health could have at that point. Looking here, there's 300,000 people. I'm just looking at the date. That was back in 2020. Were out of work, being sick, injured, or disabled within this age bracket alone. So inevitably, we as occupational health professionals could have a significant impact on potentially on that statistic there. If we're looking at what things particularly affect that cohort of over 50s, the top 5 conditions that people suffer with ill health in that age bracket are high blood pressure, high cholesterol, arthritis, ischemic heart disease, and diabetes. Most of those things possibly not a surprise to us. We know that some of those things are simply age related. Some of those things are a general population trend that we're seeing with increasing levels of obesity and reduced levels of activity. Interestingly, the musculoskeletal disorders out of all of those actually cause the most years spent in poor health. And I suspect that is primarily because it's a chronic condition in terms of things like arthritis, degenerative conditions worsening over time. I wonder also, this is just my sort of pure speculation really, but again, if the pandemic has had an impact on that in terms of patient access to non-urgent medical services, things like orthopedics, physiotherapy, certainly from feedback that we get from our patients, they find it difficult to access those services. There's long waiting lists still in place, and therefore that's going to contribute to the longevity of those particular conditions. If we're looking more so at the main sort of musculoskeletal conditions that are affecting people. This is a worldwide statistic. It was slightly harder to find ones purely relevant to the UK, and I believe this is going to be shared outside of the UK too, so perhaps a bit more relevant. But looking at osteoarthritis being the condition that affects the most amount of people, the wild is years lived with disability. Non-specific neck pain, amputations, rheumatoid arthritis, and then gout. And obviously, as physiotherapists, things like arthritis, neck pain, rheumatoid arthritis, all of those things are things that we can really effectively help people manage and advise them on, improve their lifestyle, improve their symptoms, and help them have, hopefully, longer access to their employment as well. Just touching on exactly what occupational health physiotherapy is, I think even some physiotherapists are not really sure what we do as occupational health physiotherapists. It's not something that is taught on undergraduate courses, despite its, there's a great need for physios within this sector. It is something that involves postgrad training or upskilling. It's not simply just, plonking a physio in a work environment to work as we would do maybe in an outpatient department. It's really looking at balancing this relationship between employers and staff to try and help with health problems at work, improving the health and well-being of workers. So although we are looking at musculoskeletal disorders primarily, not solely, but primarily, that well-being part of that is so important. Physical and mental health, we know, are so intrinsically linked. And I think physios are often very good listeners. We're very good at giving people time and spending time with them, helping them access other services that help with their general well-being. We're also able to combine our kind of acute medical knowledge, our assessment skills, and our therapeutic skills, along with detailed analysis of workplace environments, job roles, and the tasks that employees are being asked to undertake. And then actioning what we're finding. So communicating with the employer and the employee regarding things such as maybe equipment provision, behavioural task modification. It could be advice around fitness for work, maybe assistance with suggestions for altered duties or return to work plans. Looking to try and mitigate risk where possible, and trying to help both the employer and the employee. Excuse me. And crucially, being impartial. We're usually in a position, I'm sure, like many of you, where the employer is the one paying for the assessment and bringing us in and asking our opinion, but we are there to be impartial and objective, and maintain that throughout. It's not a side-taking exercise. In terms of the benefits of occupational health physiotherapy, it's widely quoted that for every £1 an employer invests on providing their staff with an occupational health physiotherapy intervention, whether that is on-site treatment or whether that is fitness for work assessments or DSE assessments, we'll come on to all those various options in a little bit, that they save between £3 and £12 for every £1 invested. So it's a really good investment from an employer's point of view. And the return of that comes really in reduced rates of absenteeism, reduced rates of presenteeism. So there's a bum on the seat, but not actually much work going on. Improved retention and possibly also recruitment of staff, and increased productivity when staff feel well looked after, when they feel valued, when they feel like they have these added extras of people caring, they often are able to kind of deliver more for their employer. So really, what does occupational health physiotherapy look like? And in a word, it doesn't look the same for anybody. It really can be tailored to each individual client, each individual scenario, depending on what's really required, what that employer or employee needs from us. It could be on-site physiotherapy clinics, which very much are like an outpatient type service. It could be one-off assessments for things like workstation assessments or DSE assessments. Could be sort of ever increasing more complex assessments. So we're looking down this list at workplace assessments, mini functional capacity evaluations, or kind of full-blown, very complex functional capacity evaluations. So if we break down each of those services, the on-site clinics provide a really easy way of accessing the service, often via self-referrals. It allows early intervention, which is really key for people with conditions that potentially are more chronic. So certainly that sort of aging population. Early intervention is key. Self-management, accurate information, all of those things delivered at an early stage give us a much better outcome long term with patients. Often with these kind of services, they're not limited in the same way they are for things like NHS services. I have just realised my battery is not plugged in, so I do apologise. I'm just going to plug that in. And so that allows us to really deliver a full rehabilitation service. Which means that we can do all of those things. We can do the prevention work. We can really make sure that somebody is fully rehabbed and not going to kind of fall backwards again. Sometimes it's around things like the use of how to access private medical insurance if there's a company scheme in place, or it might be liaising with a GP to access onward referral for investigation, or orthopedics, or other consultant appointments through the NHS. It also saves an awful lot of downtime. So in terms of time out of work, attending appointments, you don't have that travel time. It means that there's much more, it's much more efficient. When we're looking at workstation assessment, DSEs, those sorts of things, sometimes those are carried out by those on-site physios. Sometimes we're asked to come in and deliver these for more complex medical issues. It might be that, for example, somebody has osteoarthritis of the hip, and sitting in this lovely 90-degree position as per their self-assessment tick list is actually really uncomfortable, and we need to think outside the box. We need to look at possible alternative equipment, advice, those sorts of things. It can also be for things like this, additional training needs or behaviour changes. It's not just about trying to provide everybody with a lovely magic standing desk. I'm sure lots of you probably go into lots of offices and see rows of standing desks all being sat at. Those behaviour changes have to be communicated and actioned, and also to get the benefit of those sorts of equipment being there. But also things like use of technology, things such as voice to text software, programs like Grammarly that can check your work, things to make work more efficient. So perhaps you're not sitting for such long periods at your desk in order to do those things. We often find as well that it actually saves employers money from buying incorrect equipment. we go into offices and we joke about the graveyard of equipment. There's usually like a room stashed with things that people have randomly bought from Amazon that promise to cure every known condition to man. But often just going in, either adjusting or teaching people how to use what they have, or just making simple recommendations can often be really effective, and save the employer significant amounts of money that way too. Interestingly, when talking about things like use of technology, making life easier, when we're thinking about the older worker, for those people, they are not the same as, perhaps the younger population that have grown up with everything being a smartphone, everything being a computer. They might need additional support to utilize those things, and utilize things effectively. So they're not having to spend long periods of time trying to wade through how to do it. They might need things such as kind of typing training. So learning to touch type effectively rather than what we call seek and peck, typing with your index fingers. If you have significant osteoarthritis of your hands, having good typing technique or being able to use voice to text software can really be transformative to your pain. But you need to have the skills to do that, and you need the time to be able to learn those skills. But I thought this statistic was quite interesting, that workers aged over 50 are the least likely to receive off-the-job training. And by that, they mean anything conducted sort of a classroom setting or additional training, not just basic job skills. And yet, I think if we think about particularly technology, all these new things that we could be utilizing for people, there's an argument to say that perhaps that cohort actually might need more time rather than less. When we're carrying on through that list of sort of escalating options, with our physiotherapy interventions in the workplace, the next kind of step up would be a workplace assessment. These are always done on site, looking at the work environment, the tasks, the techniques, the individual's ability, and also obviously always taking a full medical history to marry up any issues that they have, any physical deficits that they might have with the tasks that they're required to undertake. Again, with these, we're often making kind of workplace assessments and suggestions of reasonable adjustments or modifications. Again, it could be to do with equipment or the way in which they're working, the working pattern, the hours, those sorts of things. And again, training needs that can often be really helpful. When we're looking at kind of the most complex form of workplace assessment, we're looking more at a functional capacity evaluation. Now, this is often a really long assessment, can take, the whole day really. It looks at physical impairments set against a set of standing testing protocols. So it gives very data-driven information around people's ability to do certain things. They really are very complex. They're very useful for the right people. We currently also have kind of formulated an in-between assessment between the FCE and the workplace assessment, where we use a smaller selection of standardized testing to give us that useful data that's just very specific to a certain client and job roles that are being carried out. And we find that really helps to support our recommendations in terms of suggestions with kind of return to work plans or altered duties, those sorts of things. It often always can actually surprise the individual as well. So when we're giving them feedback about how they've scored on various things, often they'll find they'll do better than they thought they were going to do. and that sort of fear avoidance behavior that we can see when we have kind of chronic problems or been off work for long periods of time. Being able to look at those results can be quite useful for patients to give them confidence in returning to work or tackling new tasks and progressing the number of hours that they're working. So I think I put this little slide together really because I think it's just really important, this one phrase, that occupational health physiotherapy is relevant in all workplaces and for all employees. There is something that's suitable for everybody. We currently work in all kinds of sectors, TV and film, power stations, brickworks, retail, banking, offices, all over the place. And there's tools that are there that we just need to marry up to for the right purpose of the client. And we usually need to give them some help with selecting the right tool for the job for them and explaining to them to assist them in getting the information that they need. But I think just to kind of summarize really that the aging population is likely to continue to rise, and with that, employees suffering with ill health and especially musculoskeletal conditions are likely to be greater. That we've got an effective and efficient tool to help those employees in terms of occupational health physiotherapy, and that it's a really sound investment for employers. So I've just popped on the bottom there is a clinical interest group, Association of Chartered Physiotherapists in Occupational Health and Ergonomics, if anybody wants to kind of have a look there for some additional resources. Our website or my email. So if anybody wanted to contact me to ask any questions, then do feel free.
Thank you so much, Rebecca, for this excellent presentation.
It's a pleasure. I hope it was useful. It's a very wide remit in terms of occupational health physiotherapy, but yeah.
It was an absolutely lovely, comprehensive presentation. Many thanks for that. At the moment, I do not see any questions from participants in this webinar. So if you don't mind, I ask my own questions. Is that okay?
Of course it is. Yeah, go ahead.
Okay. At the moment, cost effectiveness of occupational health activities is a very hot topic that we are very active on the matter at the moment in the Society of Occupational in ADESO, and basically just trying to provide more evidence about that, which is going to be helpful in our negotiation and our communication with the government. To my knowledge, there is a paper about occupational health activities in firefighters in Australia, which shows something about 1 to 9 return of investment of occupational health activities when they train managers. But there are not that much, evidence about general occupational health activities. What you mentioned about return of investment out of occupational physiotherapy, which is about for £1, there would be about £3 to £12 return, is absolutely amazing. And personally, I agree with that. Based on my personal experience, based on what you can do for the employer. But is there any proper research or paper or evidence about this, or is it something that our colleagues in the world of occupational physio would feel that this is going to be the case?
I think I'll have to dig it out, but I think there are a few different bits of research that are around. I think there's something on the ACPO site, but I can certainly look for something more concrete and be able to send that over to you, if that would be helpful.
That would be very helpful, especially these days, because as I said, we are just gathering evidence about cost effectiveness of occupational health services.
Yeah, sure.
And occupational physio, of course, plays a very important role in the whole world of occupational health.
Yeah,
Considering,
yeah, no problem. I mean, there are some papers that kind of, or some stats where I'd seen the kind of up to 20, and I think that's possibly a little bit optimistic, but I think even if you look at the lower end of that three, you know, for every pound that you're investing, it's still a really significant saving. And certainly I would say most of the businesses that we go into, I think are surprised, because I think sometimes there is a bit of a stigma of, oh, if we're going to bring someone in, oh, they're going to tell me I have to buy that chair that costs £2,000, and they're going to need a desk, and they're going to only be able to work 2 hours a day, and you know, and so I think sometimes employers are a little bit reticent. They feel like it's going to cost them a significant amount of money. Um, but I think often they're surprised in that, you know, if it's needed, of course, we'll recommend it. But we are there to kind of provide that independent piece of advice whereby it's not just what the employee says they want, this magic chair that someone else has got. It's about what's needed, it's about what's appropriate, it's about what's right at that point in time. And a lot of that is often around the kind of behavior changes, the, you know, changing all of those attitudes. Some of the things I didn't touch on actually, but things like not booking meetings back to back, like just a cultural thing across an organization to allow people that time to move and break and, you know, do all those things that can be just as valuable and don't really cost you money. It's not about being a slave to the screen for, you know, 8 hours a day. But I'll definitely look that out for you and see if I can find a specific
Many thanks. If there is
reference.
anything, I appreciate if you share it with me, but no pressure at all. I know how busy you are.
No,
But that's
that's
going to
fine.
help
That's fine.
us just in our conversation with the government, especially at the present time. Many thanks. So I can see some questions now coming up. The first one is it's a general question. It's a very interesting one. Do you have a source for, this is the second one. The first one is by Bilal Beg. How do you think we can help move away from the stigma of OH being associated with losing your job?
Yeah. And I do think that is a barrier that we do come up against when we're going, and particularly to do the workplace assessments where we're looking at, you know, making a recommendation around fitness for work. People are often very defensive. They're really anxious, understandably. They've often been off work for a long period of time, or there's lots of workplace pressures to, you know, return to their full role, or that perhaps they feel they can't do. I think a lot of that stems from just communication, just being really clear with patients, that initial contact, even from kind of booking the assessment with the administrative staff, being able to explain what that assessment is about, um, getting them to engage and really understand that we are there in general to try and help as much as we can. But of course, again, maintaining that objectivity of that position between the employer and the employee to um, yeah, really support both parties.
Great. Thanks so much. Yeah, I agree with you. It's mainly about communication, but just to give a more practical example, this is how I do it in my own practice. When, you know, I start a consultation, I introduce myself that I'm Dr. Santi, consultant physician occupational health, and my job is to make sure that your job doesn't make you ill. This is how I introduce myself and how I briefly explain about my job. So, and then, you know, if the patient would be concerned or they're going to be understandably anxious, I try to explain about the role of occupational health and how we can support, you know, the employee in maximizing their functional capacity in a way that they'll be able to do the job, or just all the things. So it's all about communication. I completely agree with you, but it's not easy. Sometimes it may be very, very difficult. Great. So, Bilal, hopefully that's a helpful answer. So we proceed to the next one. Next question by Hatem Hamdi asking, do you have a source for the mini functional capacity evaluation that you were referring to? It's mainly about the mini one, not about the functional.
So it's something that we've kind of created ourselves in terms of just looking at a specific client that we have. So we looked at the various barrage of tests that you can do in terms of what might be included in a full functional capacity evaluation, and then looked at those things that we felt were most relevant to the particular job roles that we're going out for this client. So we tend to use things such as the 30-second sit stand test, a 2 or 6 minute walk test. We might use like the chest to step test, for example. So you can imagine these people are walking a lot, they're doing stairs a lot. We might try to think what other ones we would tend to use. So really just tailoring it to make it more manageable. It's more affordable for the employer. It's more relevant because these people are not people that have suffered kind of multiple traumas or significant long-term neurological deficits or those sorts of things that we might use a full functional capacity assessment for. But it still gives us really clear data. And it means that when we've got multiple physios going out to do these assessments across the country for the same client, but in different locations, they're going to get a report that's very consistent and is able to be interpreted in the same way and very clearly by managers.
Good, great.
I hope that answers the question.
Okay, and thank you so much. So do you have any link or something in your website or somewhere that you can share with our colleagues today about mini functional capacity assessment?
Not at the moment, no, we don't. But maybe that's something. I mean, obviously, if anyone wants any more specific kind of information or anything, feel free to send me an email. I'm going to share the slides with Nick, so my email will be on the bottom of there. So feel free to get in touch and ask any other specific questions, or if people have questions around those sort of normative data tests or things, then that's fine.
Great, good. Thanks for that. Many thanks. The next question by Jenny Otu, and referring for FCE is key to return to work and avoid challenges at work. Larger companies can maybe afford. What about SMEs? So yeah, smaller companies always just, they have funding issues, that's normal. So what do you suggest, Rebecca, for SMEs about occupational physiotherapy?
I think it's always a challenge, isn't it? Affordability is always a challenge. I don't know that there's an easy answer to that one, really. It's maybe reaching out to occupational health professionals and really asking the question of what you need as an employer, what you're trying to get the answer to. Do you really need a full FCE, or are there other options that maybe are, a bit more affordable? Obviously, it's important that it's the right assessment for the right purpose. But often there are alternatives that can be discussed. So I think reaching out to an occupational health physiotherapy company, people are always willing to talk to you and give you advice. There's no sort of commitment at that stage, so it's well worth just spending the time to pick our brains a little bit and see what we could come up with to help.
Thank you so much. Actually, I think the question should be mainly for the government rather than for you, that how SMEs could be supported with health and well-being at work. And Bilal has kindly put some message here saying that there is now a DWP funded bracket 80% scheme which aims to allow all employees, even those in SMEs, to access OH services. So this is mainly for the government to see how SMEs could be supported. But alternative approach could be, rather than providing them a full service, just providing them some sort of occupational physiotherapy services when need be, based on, say, the cases they have, both for treatment and also for any sort of functional capacity assessment or things like that, just to bring the cost.
For some services,
down.
we find that we do that patients that have, excuse me, or employers that have some form of like long-term sickness insurance, they can actually access some funding through those sorts of things for.
Yes. Great. Thanks for that. Sue Coffey has kindly shared her experience here. Thanks, Sue. Sue, are you there? Do you want to talk to us about this?
Oh, hello. Gosh. Well, yes, it was the start of my career in occupational health physiotherapy years ago, working in a mental health trust. And I realised watching staff literally limp around the place, that they really needed some support, and found increasingly as I offered support, it was readily taken up. So the chief executive readily, having gone round and round the circles with trying to make the business case, the chief executive eventually just gave me £50,000, which was very gratefully received, to develop the service. And one of the features was drop-in clinics, particularly in areas of high injury and high sickness absence. So we focused on older people's services, a heavy service, dementia, some of it sort of continuing care, end of life care. And it was astonishing, number one, the impact on sickness absence across the directorate. And number two, the fact that people would actually readily admit that they'd come to work only because they wanted to access their physio in the drop-in clinic and get some advice as soon as possible, so they'd come in, and then we could put recommendations in place that would modify what they were doing because they'd had an injury or they'd got a flare-up of a chronic condition. And it worked extremely well and was really, really valued. And the drop-in service generally had a little queue constantly through the day that it operated. So it was well used, very popular. It was a very enjoyable service to get moving with.
Many thanks, Sue. Many thanks for sharing your experience with us. As you may have noticed, Society of Occupational Medicine is now asking for any case studies that you have with us, and that's going to help us to communicate that with the government and have more case studies. So if any of you would be interested, it would be much appreciated if you can please share your case studies with us, please. Thank you so much.
Okay.
Many thanks, Sue. Great. Okay, and just let me see. I think at the moment there is no further questions. No, there's no further questions at the moment. Just one more point. Rebecca, you started your presentation, the first slide, I think it was about the definition of occupational health and improving health and well-being of employees and this and that, which is absolutely lovely. And what I've been thinking about is just adding happiness to that, actually, happiness in the workplace to that definition as some part of activities OH can do. And what you occupational physiotherapists are doing at the moment, because what you do is very tangible. Say you go and you just do a workstation assessment or a new chair or something, very, very tangible. I've noticed it really brings happiness to some of the employees, and they really love it. What do you think about that?
No, I think you're right, and I think sometimes it's not what we do, but sometimes it's just two things. Sometimes what we do in terms of listening, just giving somebody the time, being able to feel heard, being able to feel understood. Often these people are very frustrated. They don't feel like they can get much time with their GP. They feel like they've been fobbed off, or they're on a massive waiting list, and they've got pressure from, reduced income, and they've got pressure at home, they've got pressure at work. It's really, they're often quite stressed. And so to have that opportunity to sit down with somebody for an hour and a half and be heard, I think people find really cathartic. And also often just the advice that we can give, not just the provision of stuff, but just access to other services, just pointing them in the right direction. It's often things that don't cost anything. It's not, expensive. It's just around understanding how to use services. A lot of the businesses that we go into have private medical insurance, for example, but often people don't really understand how to use it. I can't get to see my GP and I can't do that. And just giving them, empowering them to take some control over their health, I think can be really cathartic for them and really productive. And that leads to happiness, doesn't it? If we feel better mentally and physically, they're so intrinsically linked. it generally leads to a happier and healthier workforce.
Great. Many, many thanks. Thank you so much. Do not see any further questions here at the moment. Any further questions by the audience? Okay, so let me just say a big thank you to you, Rebecca, and to all who have attended this lovely webinar. Many thanks to all of you, and wishing
Thanks so
you
much.
pleasure, wishing you a wonderful evening today. Thank you so much. All the best.